Hi, I'm Nicholas Sorkine, a senior studying psychology. This study, Opposite Effects of Chronic Stress on Context-Induced Relapse to Palatable Food Seeking After Punishment-Induced Abstinence in Male versus Female Rats, continues Dr. Ball's work in studying the effects of stress on relapse behavior in rats. The intention was to study relapse behavior in order to understand similar behaviors in humans, and to better comprehend relapse behaviors in the context of dieting or substance abuse. For this study, we trained groups of rats to press a lever in order to receive palatable food, and allowed them to use this lever every day in 2-hour sessions for 10 days. Half of the rats were placed in boxes marked Context A, while the other half were placed in boxes called Context B, and these two sets of boxes were visually distinct from each other. After 10 days of self-administration, all of the rats were placed in the opposite context from which they started, and, while still allowed to self-administer, were exposed to mild foot shocks on 50% of lever presses. At the same time, half of the rats were placed in restraints following their sessions in order to induce chronic stress. After repeating this daily for 8 days and waiting 1 week after the last session, all rats were subjected to relapse testing, where over the course of 2 days and with counterbalancing, each rat was returned to its original context in which no punishment was received, and the context in which they received foot shocks and possibly restraints. A rat's pattern of weight gain or weight loss can be used as a rough measure of their stress, so the rat's weight was monitored daily. This data, and the recording of lever presses throughout the study, provided our results. The effects of stress were seen in both sexes, as well as a vulnerability to context-induced relapse and a decreased amount of lever presses when subjected to the restraints. However, females appeared more resistant to the stress overall, as evidenced by greater weight gain and more lever presses during the punishment phase. And the chronic stress from the restraints caused a significant increase in relapse behavior in males and a decrease in that of the females. Translationally, this suggests that it is possible for women to be more vulnerable to dietary relapse, except when subjected to chronic stress, after which males would be more vulnerable to relapse and females less so. Further study of this may help to better inform sex-specific interventions for dietary relapse and other stress-related behaviors.